Have you been laid off work with no insurance? Now that there's a pandemic going on? What if you need health care? What are you supposed to do? Well, there's help out there. In 1946, the 79th Congress passed a bill known as the Hospital Survey and Construction Act. It was sponsored by Senator Lester Hill of Alabama and Senator Harold Burton of Ohio, hence the name Hill-Burton Act. In 1946, President Harry S. Truman signed the bill into law. It provides government funding to help medical facilities improve their supply, distribution, and quality. But what did the government want in return for this financial assistance? They wanted the facilities to help low-income citizens and low-income residents with reduced or free health care services in perpetuity, as in forever. Today, or once it was passed, it was set to expire in the early 70s, but at the last minute, it was given an extension in 1973. In 1975, it became Title 26 in the Public Health Service Act, and is still on the books today. Today, facilities are still required to provide assistance for low-income individuals and low-income families at reduced costs or free health care because of the Hill-Burton Act. It's managed by the HRSA, Health Resources Services Administration, or HRSA.gov if you want to look into them more deeply. What's the takeaway? Here's the takeaway. If you're out of work and without insurance, during this pandemic, take advantage of the Hill-Burton Act. Take advantage of it. Our tax dollars are paying for it. You might as well use it. Google Hill-Burton. Don't take my word for it. Google Hill-Burton Act and look for yourself. Or if you like, you can go to the HRSA.gov and in their search bar, type in Hill-Burton and hit the enter key. And the page that comes up under their search for their site for the Hill-Burton, click on the top link of that search result on the HRSA.gov site, and then scroll down and find the link for the Hill-Burton list of obligated facilities. Click on that. It's a long spreadsheet. That long spreadsheet has over 130 facilities nationwide that are still required to this day to provide free and low health care costs to needed individuals under the Hill-Burton Act. It's a long spreadsheet and it has over 130 facilities on it. So be prepared to spend some time on it. For example, here in Illinois, even though it's not available everywhere, here in Illinois, there are seven facilities here in Illinois that are still required to provide reduced or free health care to those in need, to those low-income families or people who are out of work, for example. There's 5 in Chicago, 1 in Rockford, and 1 in Decatur. So definitely look into it. Go to the Hill-Burton Act, look into it, and use that to your advantage. Because after all, if you don't know about it, you go without it, even though you're already paying for it in your taxes. For more information on what I can bring to your organization, go to adviserspeaks.com. I'm professional speaker Paul Calhoun, and you have just been advised.